Bootcamp My Dog Has Diabetes, one of two. Brought to you by Vintech Nutrition, LLC. Recognize the signs: frequent urination, excessive hunger and thirst, weight loss, cloudy eyes, cataracts forming, lethargic. Bring your dog to the veterinarian. You are not alone. Statistics: canine diabetes is more common in older dogs. It is estimated that 1 in 308 dogs have diabetes. This is increasing at a rate of 32%. This exponential increase is greater than that in people. Most dogs are type 1 diabetics, and therefore they need insulin injections. What do I do? Veterinarian. Follow veterinarian's advice and start initial insulin regimen, adjusting slowly. The veterinarian will monitor results by using a blood glucose curve, which consists of many different readings over the course of the day. Most dogs use 12-hour insulin. A correctly calibrated needle is necessary for the type of insulin used. The amount is measured in IUs, or international units. The syringe used will indicate IUs. The insulin bottle and the syringe must both indicate the same IUs to be accurate. Insulin. There are different types of insulin. Vetsulin, veterinarian prescribed for dogs. Vetsulin is measured as 40 IUs. Humulin N and Novolin N, both made by Eli Lilly, are available without a prescription. Although designed for people, they are commonly used in dogs. Humulin, Novolin N are both IU 100 measured insulins. Supplement. Diabetes is administered in conjunction with any insulin. Although your results may vary, diabetes can allow insulin reduction ranging from 15 to 67%, as well as more stable BG levels. Be aware that you may need to reduce the amount of insulin given. If so, this can save money on insulin costs. When BG levels are more stable, sudden spikes and drastic drops can be avoided. Blood glucose monitoring. Blood glucose meter. AlphaTrax is a specific meter for dogs. A1 Care by Bootcamp Diagnostics. The same A1C test that has been the gold standard for people for 20+ years is now available and affordable for dogs and cats. The A1C test can be used for initial diagnosis as well as monitoring long-term blood glucose (BG) levels, providing up to 100 days of data with only a couple drops of dried blood. BootcampDiagnostics.com. Blood sample. Using a sterile lance, collect a sample by poking the ear, the inside of the lip, dew claw above the front paw or other area. Follow veterinarian advice and ask for demonstration. When to draw a blood sample. At the 6-hour point, halfway between the 12-hour cycle. For example, if morning feeding is at 6 a.m., the test should be conducted at 12 noon. A normal reading should be in the 80 to 120 range. See blood glucose curve graph. If too high, adjust insulin up a little at a time based on veterinarian advice. If too low, you may need to give your dog glucose, syrup, etc. This is a dangerous situation. It may cause seizures and even death. Symptoms of hypoglycemia, BG too low, weakness, depression, behavioral changes, muscle twitching, anxiety, seizures, coma, death. Tips, tricks, and traps. Feed, shot, diabetes. Next video. The Simoji effect is a rare occurrence. A blood glucose curve by your veterinarian can help with detection. It can be hypoglycemia, low nadir, followed by rebound hyperglycemia, high reading. BG too high, hyperglycemia, may not be giving enough insulin, insulin resistant, improper feeding, stress associated with veterinarian visits. BG too low, hypoglycemia, may be giving too much insulin, missing or delaying food, change in diet or amount fed, infection or illness, change in appetite or vomiting, increase in activity, interaction with other medicines, adrenal, thyroid gland disease, pituitary issues, or liver and kidney disease. If hypoglycemia is observed, immediately do the following. Contact your veterinarian immediately and rub corn syrup on lips. Absorbs quickly, 1 to 2 minutes. After dog can swallow, feed a small amount of food. Your pet may need to be hospitalized for treatment. Diabetic ketoacidosis, DKA, complication of type 1 diabetes mellitus. a life-threatening condition resulting from dangerously high levels of ketones and blood sugar. The combo makes the blood too acidic, which can impair the normal function of organs, causing such things as liver and kidney failure. Symptoms of DKA: extreme thirst, frequent urination, dehydration, nausea, vomiting, stomach pain, tiredness, breath that smells fruity, shortness of breath, feelings of confusion. Cataracts from high BG may develop in as little as 1 day. Optional cataract surgery is available through specialists. Other symptoms: lost effectiveness of insulin, excessive water consumption for more than 3 days, excess urination that is abnormal for your pet, nighttime, and inappropriate urination in the house, reduced or complete loss of appetite, weakness or seizures, muscle twitch or anxiety, constipation, vomiting, or diarrhea. Signs of bladder infection: small frequent urinations, straining, blood in urine, swelling of the head, neck, or insulin injection sites, ketones in urine, poor skin and coat condition, bad breath. Urine is sugary and sticky if left dry. Consistency is the key. Feed, give shot, and give diet treaties at the same times each day. Food choices: wet food with minimal carbs. However, this may be too expensive for large dogs. For more information on treating your diabetic dog, please see our second video entitled Bootcamp 2: How to Administer Diet Treaties into the Regimen.